So welcome everyone who is attending this pre-Congress session titled Aging in China. Many of you, of course, know that aging is a very big challenge for China in terms of its healthcare system, and also its pension system. It also has major implications on the economy, on productivity and labor participation. It is a complex area, but the rate of aging in China at this point is exceeding any others that we are seeing in neighboring countries or in the advanced economies. And in fact, aging is on the top priority of the Chinese government in terms of social policies. So today we're very honored to have 4 speakers who I think are the leading economists in China working on multiple aspects of aging, and then 4 panelists who are equally knowledgeable about the various aging-related issues and social policies in China to provide commentaries. We have 2 papers that are centered on long-term care insurance and 2 other papers that is more focused on pension and retirement. I'm going to invite each speaker to speak for about just 12 minutes. I'm going to be quite strict in monitoring time. And when you reach 10 minutes, I'm actually going to tell you that 2 more minutes. I can type it in the chat box, but many of you have told me that actually while you're talking, you're so enamored and excited about your talk, you actually don't look at the chat box. So I might appear to be a little bit rude by actually saying 2 more minutes. And I would like you to keep to time because we do have 4 very rich presentations and then the discussants commentaries. And we also want to leave lots of time for interactions between the presenters, the discussants, and also the attendees. So, and a lot of rich conversation actually comes from that discussion. So without further ado, I'm going to introduce the first speaker. Our first speaker is Xiaohan Zhang from UCLA, and she will be presenting a paper that she co-authored with Professor Feng Jin and Ai Qingyi from Fudan University. And the title of the paper is Covered Elderly Care and Labor Participation, Evidence from Chinese Long-Term Care Insurance Program. Xiaohan.
Thank you. Can you see my slides now?
Yes.
Okay. All right. Thanks, Winnie, for the introduction and for inviting us to this talk. And thanks for everyone who's participating today. So our paper topic is on covered elderly care and labor participation and evidence from Chinese long-term care insurance program. So as Winnie have introduced, aging is really one of the major issues that we're facing today. And thinking about aging, one of the dilemmas an elderly person is facing today is both the increasing life expectancy and the ever more expensive elderly care. So just to give you a couple of numbers to get a sense of this. So in Shanghai, for example, in 2017, and the elderly care nurses cost more, actually 1.5 times more than an average pension benefit for local residents. And in the US, the annual cost of elderly care is also more expensive than the average household income. So to resolve this dilemma, most elderly people have to resort to either having a higher saving rate and or just involve in more post-retirement labor force participation. And the problem is also more severe for low socioeconomic status individuals and those individuals who doesn't have a lot of children. And with a ever lowering birth rate that we're facing, the problem will be probably more exacerbated in the future. So here is a graph that just demonstrates post-retirement labor force participation for elderlies. is actually not very low. So this is number using urban population who's under the coverage of urban employee health insurance in China. And then despite having a mandatory retirement age for both male and female, you can see a pretty sizable labor force participation even after retirement. And it kind of diminishes right around the age, or it kind of goes down to a very low level right around the age of 70 or 75, depending on the gender. So overall, there is an elderly informal labor force participation post-retirement. And to think about the labor force participation problem in relationship to old age welfare programs, and there's some literature on that, and most of them documents a disincentive to employment. For example, there are literature on Medicaid, veteran health insurance, old age assistance, or disability insurance in the United States. And all of them documents a disemployment effect. And for a similar measure in China, as to our best knowledge, we don't see a literature, at least not a large literature here, on the relationship between welfare programs for elderly people and post-retirement labor supply. So the theoretical prediction of such an effect is unclear. So if you consider that being covered by a health-related program would cause you to have a healthier life, longer life expectancy, then it would in turn require more savings for your lifetime expenditure, which then motivates more working in your lifetime. On the other hand, if you consider this from the angle of a subsidy, then the income effect should motivate you to work less. So the two, there are effects pushing both ways, and we're not sure what's the net effect. The causal evidence on long-term care literature is mostly focusing on crowd-out effect. The crowd-out is between enjoining long-term care benefits versus putting more or costing more medical expenditure. And similar effect is also found for the Chinese long-term care insurance program. Other literature also covers some measures of health, such as pain and depression, and there a very important discussion of the quality and the equity of care offered by long-term care insurance. There are also some literature on spillover effects on family members, but the effects on labor market is still understudied. So just a preview of our results. We think this paper, and to the best of our knowledge, is the first to examine the labor participation effect of the Chinese long-term care insurance program on potential recipients. And I would like to stress the word potential recipients because we're not thinking just about those who actually receive the long-term care benefits, but those who would be qualified. So the paper really covers the effects of future long-term care burden, the reduction of future long-term care burden on present economic and behavioral outcomes. So you're foreseeing that you will enjoy such a benefit. And we found a significant reduction in labor participation and also household income. While we do not observe other adverse effects on measures of well-being, such as health or consumption. And we also have taken two angles to think about this question. One is that long-term care benefit would would influence individual labor force decisions, but also this could be a household level decision, and we observe effects on both ends. We found more prominent effects among elderly who are relatively unhealthy, which kind of matches our expectation of the effect. And we also do not observe spillover effects to the children. Due to the time constraint today, I will not be presenting a lot of results on this, but these results are available upon request. So this is also one of the first attempts to quantify the relationship between covered care programs in China and elderly labor participation in urban China. And we think this is a really important issue facing the aging economy because if you think about it, we have on one hand the discussion of how to offer a better retirement experience for elderly residents. And then on the other hand, we're trying to think about stimulating elderly labor force participation. And the effects we found kind of enlightens some of the policies in this literature. And we also find a consistent life cycle effect to other welfare policies in United States and other countries. Okay, so just to give you a very quick preview of the policy background, the rollout of the long-term care insurance program started in 2016. Despite there were a few cities already had their own long-term care insurance program prior to that. And this first round of rollout are the ones that we are able to use in our study. There is a second round in 2020, but it's kind of outside of our sample range. So in order to show a geographic dispersion of these cities that enjoy a long-term care program, you can see that the light, slightly darker blue shade areas, they are cities included in our data set, and then all shades of red are waves of implementations and rollouts of long-term care programs that's covered in our study. And here's a list of all the cities that we're considering here. And besides their implementation time being slightly different, you can see that the policy details can be slightly different across geographic areas as well. They might cover sometimes only the urban residents, other times urban and rural residents who already enjoy a healthcare program. And sometimes they have overall implementation in the entire city, and other times a partial implementation. So we do have subgroup analysis based on all aspects of these policies. And the eligibility of this program is mostly based on health, and the benefits are generally considered to be very generous. There are numbers that documents that in the pilot cities, long-term care programs covers about 70% of the listed services, and it also can cover about 50% of the total care expenditure in some cities. And local policies are different, which is shown in the previous slide. Okay, so the empirical strategy we're going to use is a very basic difference in difference. And we constructed our control group to be those individuals living in cities without a long-term care program, but they are covered by the urban employee medical insurance. And then our treated group would be the long-term care benefits who are technically all covered by the same insurance program as well. So the terms we have here, the Y is the outcome variable, and then the treat is the treatment dummy. Post-by treat is after long-term care program implemented. multiplies the treatment dummy for the city. X here is a vector of individual controls such as age dummies, gender, hukou status, education, marriage status, and whether their spouse is covered by insurance, the age gap between the spouse, and we think this is important because sometimes if the age gap is big, then the domestic caregiving can be influenced, and then the number of people in the household and income per capita. We also have a selection of city-level characteristics, and we use the characteristics a year prior just to control for the city heterogeneities. We have city fixed effects, and when we do include this dummy variable, it absorbs the treatment dummy in the first row. And we have year fixed effects, and city-specific time trend is a linear time trend, and our standard errors are clustered at the city level. And the data we're using is Charles, and we're using the 2011 to 2018 4 waves of Charles. And Charles is a survey that targets individuals usually older than the age of 45. And for this particular,
you should try to wrap up in a little bit more than a minute and a half.
Oh,
yes.
Okay. So in this study, we're actually looking at people who are older than the retirement age and younger than 75. Okay. So just to skip ahead to the results, we find negative labor force participation effects and negative employment to population ratio, and also negative effects for having any kind of work that's on average more than 1 hour a day for the individual decisions. And we also found that these labor force participation declines are focused on people who are working in corporate environments rather than self-employed or an agriculture job. We don't find changes in chronic disease, and it's kind of expected because most people are not actually receiving any coverage yet. But we do find reduction in depression, which is consistent with a Chalmers paper that we introduced earlier. And if you split the individuals by group, you can see that the healthier individuals have a lower response versus the unhealthy individuals have a much more significant response. We also consider this as a household decision, and the results are consistent both in magnitude and in sign with the previous individual level results. If anything, they're a little bit larger. And we also see that people can assume less full-time work as a result of a family member being covered. And another household result we looked at is household consumption and income, which reveals an interesting pattern of consuming more durable goods while reducing their fitness expenditure, which we thought was very interesting. And also we see a reduction in household income. We conduct a wide array of falsification tests, robustness tests, and subgroup analysis. Due to time, I'm not going to present most of them. Just to conclude, so we found that long-term care insurance coverage will decrease labor force participation after retirement age, especially for the unhealthy population. And the average consumption associated with individual coverage is not significantly declined. And we also see a potential for moral hazard behavior, which requires more future studies to confirm. And we think this is a very new and useful angle to assess the old age welfare policies in China.
Great.
Thank you so much. I hope I had the time.
Thank you.
Sorry.
Yes. We will have time to come back for discussion and with the panelists and also with the audience as well. So can I turn to the next paper on long-term care insurance and by Professor Lei Xiaoyan from Peking University?
The paper is quite similar to the first one, but we look at the other population who is the target of the long-term care insurance one. And we also use another data set to do that. So this paper is collaborated with Chen Bai and Hong Liu from Renmin University and Jingpeng Hong from Peking University. Next slide. Okay, so I will skip the introduction and the literature review actually, because the first paper, Xiaohan has already introduced that. So maybe I will just go ahead to what we are doing in the paper. Can you just go ahead to say that? Okay, I will turn now. All right, so in this study, we will evaluate the impact of long-term care insurance on the well-being of the older adults and their families. That is different from the first paper. So we will look at different outcomes. The first part is ADL-related care need, family burden, and medical expenditures. And the second set is health status, including self-reported health, cognition, mental health, and 1-year mortality. And we will use another data set, which is a CLHLS, mainly focused on people who are older than 65. So that is different from the first paper. And we will also exploit the rollout of the long-term care insurance pilots across different cities during 2015 and 2017. And we will also use the DIB approach. Okay, next slide. So I will skip the institution background just to mention that the eligibility for the long-term care insurance is for beneficiaries who had to be severely disabled for at least 6 months. So our data set actually target on this group of population, and this program also had covered 3 types of long-term care insurance services, including both home care, institution care, and hospital care. And as the first presenter said, it is quite generous, actually. So I will go to the data. Okay, so the data in the CLHLS, it is a longitudinal nationwide survey, and it randomly selected counties or cities in 23 provinces, which actually hosts approximately 90% of China's total population. So we will focus on 80, although the data actually has 65 and above, we will focus on those who are 80 plus. This data set actually focused on 80 plus in the first 2 weeks, but then from 2002, it included those who are 65 and above. And it has very extensive information about the individual, community, etc. So in this paper, we in our main analysis, we will use 2014 and 2018 because the policy actually started in between. And the mean age is 83. As I said, this is the policy relevant group. And those people actually needed care for ADL's difficulty. In 2014, the fraction is about 23% actually. And for the mortality analysis, we will create a mortality panel with data from 2012 to from 2011 to 2018, but construct the panel from 2012 to 2018. So we actually have an annual data, mortality data. So for each person, we know that in each year during this time, whether they died or not. So we use both data set to analyze that. Okay, next step. Okay, so we have basically 2 independent variables. So the first one is the long-term care insurance coverage, whether they have this, whether they were covered by the long-term care insurance. And then the second one is the duration of the long-term care insurance coverage. Next slide. And these are outcomes I already introduced. So how about we just go directly to the result? Okay, next one. This is a model, I will skip that, very similar to the previous paper. So let's go to the result directly. Okay, so the main effect. So for the ADL related elder care and expenses, we look at the impact of the long-term care insurance coverage. So long-term care insurance coverage is associated with reductions in all of them. So the first one is a reduction in unmet long-term care need. That means it increases the need to satisfy the need of long-term care services by 7 to 9 percentage points. And it also reduces hours of informal care by 45 to 47% and reduces ADL-related care expenditures and also reduces out-of-pocket medical expenditure for the families. Okay, next one. And for the long-term care coverage, in long-term, 1 more year, that's the duration of the long-term care coverage. So for 1 more year of long-term care insurance coverage, it reduces the likelihood of having unmet long-term care need by 2 to 3 percentage points. And it also decreases the informal care hours and ADL related care expenditures and out-of-pocket medical expenditures. Basically, we have very consistent outcome, either we use long-term care insurance coverage or duration of long-term care insurance. Okay, next page. So for health outcomes, we actually see long-term care coverage is associated with the likelihood of self-reported good health. It increased by 3.8 percentage points, and the depression reduced by 0.43 to 0.63 points. Okay, next one. So for 1 additional year of the long-term care insurance coverage, it actually reduces, increases self-reported health being good, and also reduces the depression by this point. Okay. All right. Next. So for previous one. Okay. Previous slide. So oh yeah, next one. All right. So how's that already? Oh, okay. Finished this already. Next. Okay. So we also interact with people who whether they have care needs at baseline, which is in 2014, because we know that long-term care insurance is mainly targeted on those who actually have ADL needs, those care needs. So we interact with that, and we see actually the impacts mainly fall on those who have ADL care needs at baseline. So which is very consistent with our hypothesis that long-term care insurance actually reduces the unmet care and also all of the other outcomes, actually very consistent with the story. Okay, next. And then we look at the mortality. As I said, we just constructed the panel data between 2012 to 2018. We know exactly in each year whether the individual died or not. So we do similar analysis with that, and we will see the result. Next page. Okay, so for the effect on mortality, we see that being covered by the long-term care insurance was associated with a 0.15 to 0.2 percentage point decrease in mortality rates, and it also mainly falls on those with baseline care need. So very consistent result. And also for duration, we see here we see being covered by the long-term care insurance that by 1 more year associated with 0.5 to 0.6 percentage point decrease in mortality risk. It also mainly falls on those with baseline care need. Okay, so we also do the event study access, and we see that after long-term care insurance started at point 0, we see the mortality actually declined immediately, and it continued to decline in next year with declining rate. Okay, so that's basically what we find for the main result. And then we also look at heterogeneity for different people. Basically, we do that by household income per capita. We see that long-term care insurance mattered more for those with lower income. And next. And then we look at that by urban rural residents, and we see both urban and rural older adults benefited from long-term care insurance coverage. Actually, for the eligibility of long-term care insurance, no matter you were a rural or urban people, that actually had the eligibility. So we do see the impact on both urban and rural older adults are significant. So both of them matters, especially for unmet long-term care need and self-reported health. Okay, next.
Yeah, 1 minute.
Yes, and we also do that by presence of community service. That means whether the need in a community with some public services, elderly care services, we see long-term care insurance coverage was more effective on older adults living in communities with care service availability. Okay, so next. So conclusion. The long-term care insurance has significantly reduced the likelihood of older adults on Medicare and decreased the hours of informal care. And we also see a modest crowding out effect on private spending on elderly care, but it reduced out-of-pocket medical expenditures at the same time. Next. So we also see positive effect of long-term care insurance on health status, and especially older adults with lower income benefited more. And we see later effects on those who are living in communities that have no social service supply. So here is a policy implication. So this paper actually provided empirical evidence for the effectiveness of the long-term care insurance in improving the well-being of older adults and their families in China. And it has important policy implications for the expansion of the long-term care pilots in China. And also it have implications for the development of long-term care insurance in other middle income and developing countries. And we have some policy recommendations with our study. We may develop a universal and comprehensive public long-term care insurance, which should be separately done from health insurance. And we may build a balanced system of home and community-based services. And we also have some evidence that in the future, we should connect systematic data to compare the cost effectiveness across regions. And that may meet care needs at the control cost. And finally, okay, next. Okay, so basically that's what we are going to present in the paper, and I'm running up the time already.
Okay,
thank you.
Great, thank you very much. I just want to remind the attendees that please feel free to type your question at the Q&A box. And when you type your question, I would like to ask you to specify who is the question addressed to in terms of the paper or the presenter, so that we can have the presenter respond to you. I actually would like to pause here for a little bit and invite the two commentators, discussants, who will be commenting on the long-term care insurance papers first and have a little bit of a discussion before we go to the two papers, which is more on retirement and pension, if that's all right. I myself has a question. Both of this paper use difference in difference, and in a way there is a certain assumption that the long-term care insurance pilot program are identical or very similar across the different sites. My understanding is that there's quite a bit of variation in terms of what it covers, where the financing comes from, and I'd love to hear a little bit from the authors on that particular aspect. But before we do that, let me invite Yan Wei from UCL to provide the commentaries.
Thank you, Winnie. Thank you for the presenters. Actually, I'm from King's College London.
Sorry.
That's why. Well, perhaps I'll focus on the labour market participation paper first, which Xiaohan presented. I think it's a very, very important paper, which looks at the associations between the long-term care insurance and also the labour market participation among the older people in China. And you have got really interesting and new findings, and you suggest that long-term care insurance is actually decreasing, the labour market participation. I have actually two sort of questions or comments, mainly relating to the empirical strategies that you are using for the analysis. So the first thing is the long-term care insurance is a very sort of highly endogenous variable, and so if I understand correctly, it is still quite voluntary in many cities in China. Okay, so if you the effects that you are trying to capture here, which you seem to present that long-term care insurance is decreasing labor market participation, but it is possible that those people who are highly disabled or are severely disabled, they're more likely to sign themselves up for the long-term care insurance because they're disabled, and their labor market participation will be lower. So I don't know if you have considered these aspects in terms of empirical strategy. So this is actually my first comment. The second one is actually relating to the first one. So in the regression analysis, the control variables that you are putting on here seem to you don't really have any health variable controlled in your regression analysis, which you have the labor market participation as your outcome variable. So I'm wondering if you want to control health outcomes, health needs, or ADL, IDL indicators, which I think would be really relevant if you want to look at want to look at the effect of long-term care insurance on the labor market participation. So this is basically the first comment. The second one, one of the outcome variables or outcome indicator that you are presenting is employment to population ratio. I know the time is really limited. You have to rush through the results. I'm wondering if you could explain a little bit more about how this variable is constructed, because from the look of it, it seems that you are running the regression or analysis on individual level, but employment to population ratio, it seems to be either on a city or county or regional level. So I'm just trying to understand, how this variable is constructed, how the analysis is done. But overall, I think it's a very, very important paper. It sort of marries these two sort of fields. One is health economics and also social policy, actually three fields, and also labor economics really well. And I think it's perhaps one of the very few paper which looks at long-term care insurance and its effects on labor market participation. So this is for the first paper. The second paper, which is presented by Professor Xiao Yanlei. I think it's a very, very significant paper. And as you said, it is probably one of the first paper which looks at or did an empirical analysis on the effect of long-term care insurance on the well-being of the old people in China. And you have really amazing findings, and we actually found that long-term care insurance, have quite good performance or quite good impact on various aspects of the well-being of the old people. So my comments is again related more on the definition of long-term care insurance, like what Winnie said. As far as I understand, the long-term care insurance is a very decentralized policy in China. Actually, I was looking at the long-term care policy document in the morning, and I have found in Chengdu, basically you have to pay for the insurance for 2 years in order to receive the benefits, and you have to be disabled for more than 6 months to receive the benefits. And in Shanghai, you have to be more than 60 years old, and in some places, if you have dementia, you are not covered, so on and so forth. So how does those variations in terms of long-term care insurance eligibilities, the variations in terms of regional variation in terms of long-term care eligibility affect your results? So this is one of the questions I've got. The other one is the treatment group that you are defining in the analysis. You said that you have basically two sort of two criteria. One is the person has to be signed up for the social health insurance. The other one is they have to be targeted population, which means they have to be highly disabled. It seems that the concept of entitlement and eligibility are mixed here. I'll give you an example in the European literature. So entitlement or eligibility, there are two different concepts. So you can be entitled to participate in this insurance if you are social health insurance participants, okay? But you are only eligible to receive the benefits when you are highly disabled. Yeah, so entitlement and eligibility, these are two different concepts. If you define your treatment group as people who are entitled with insurance, but also highly disabled, and if you look at your outcome control group, you actually have a quite a big proportion of population who are entitled with this insurance, but are not eligible because they are not disabled. So they still have the long-term care insurance, but they haven't used it because they are not disabled. So in this sense, in the analysis, the effect that you're presenting may have some bias, because your control group actually have people who are actually have the insurance as well. But this is just a comment relating to the European concept. I don't know if this is relevant to the Chinese concept, but this is a comment from me. Yes, I think that's the second paper from me. I think it's also a very, very good paper, has very strong policy implication, not just for the Chinese government, but also for governments in the developing countries, especially some Asian countries who have already had a social health insurance are seeking, new sort of ways to finance their long-term care system. So I think it's a very, very important and significant paper. So,
okay,
thank
great.
you.
Thank you very much. I'm going to invite Dr. Zheyu Liu, who is substituting Dr. Huang, to provide some commentary on the two papers on long-term care insurance. Then we will have the authors provide a very, very brief response to the comments so that we can give enough time for the pension papers, and then we'll come back to discuss all of them together. Ziyu.
Hi, hello everyone. I'm Ziyu from Taikang Insurance Company. Today, Ms. Huang asked me to provide her comment in English on behalf of her. For the first paper, Professor Xiao Han provides a new perspective to the long-term care insurance research, focusing on long-term care insurance impact on labor participation. That allow us to draw a conclusion that long-term care insurance covered elderly people who have a lowering rate of labor participation. It is also made the figure of China's long-term care insurance covered group. China's pilot long-term care insurance focus on guaranteeing the severely disabled people. That means the better index equal to or lower than 40 points. From this figure, severely disabled people entirely rely on their day-to-day lives on other people's, so that they have a low labor participation due to the ability and health. Is coincidence with Professor Xiao Han's conclusion. We can continue to observe whether the retirees have an increased labor participation due to long-term care insurance expansion. In 2017, Taikang Insurance Group worked together with Associate Professor Hu Hongwei from Renmin University of China and Associate Professor Xie Hong from Peking University jointly make a survey on the frontline practitioners' ability in nursing home in China. It covers 27 cities. The results show that the average age of frontline practitioners are 49 ages older, with 70 some at their maximum. There is a severe shortage in the elderly people oriented nursing home with a lower professionalism. Long-term care insurance will greatly increase the labor participation in this field, powered by increasing demand of nursing and elderly care and a hunger for the talents. It will absorb more retirees to re-enter into the society. This is going to make up for the short-term demand for the supply, and we are expecting more research to observe the changes in this field. So this is the first comment for the first paper. And for the second paper, Professor Lei's paper provides us a great perspective by introducing long-term care insurance covered as a variant based on the database of Chinese longitudinal healthy longevity service, such as CLHLS. CLHLS is a database with great quality and precisely representing the cases needed. Long-term care insurance has just started the pilot project in China. It is going to be a perfect combination by introducing the long-term care insurance related survey into the long-term care. We can fine-tune the policies for policymakers by better observing the elderly health status, medical demand, family economic burden, and medical cost, among other impacts. In the long-term care insurance pilot system, some local governments clarify that the government can purchase the service, and commercial insurance company will participate as a third party to long-term care insurance. Since 2016, Taikang Insurance have been participating in the long-term care insurance procedure and become a part of the effort in 21 pilot cities. According to our analysis, an average of 80% disabled elderly people choose the stay-at-home service, indicating that this is the actual demand for elderly people. At the same time, stay-at-home service is where we lack most in all the services. Long-term care insurance establishment has a very strong boost to the long-term care service system and will draw more social capital to this area. Currently, a lot of stay-at-home service companies are trying to enter this field in the pilot area. From the area we serve, currently, long-term care insurance pilot programs are still at an early stage. First, we have not provided the tailor-made service to the demand, and the need for care and nurse has not been met up. Secondly, monitoring and the payment mechanism need to be further designed based on the service qualities. Long-term care insurance goal can be reached in a better way through fine and better development and policy design. So this is for the second page.
Great, thank you very much to you. I'm just going to invite the two papers presenters and authors. Why don't you turn on your video so we can have a little bit of, if you can provide a quick response, just a brief response to some of the comments, that'll be great. And we'll spend more time to discuss later on. The first paper, is it Shahan or is it Professor Feng? You will be doing the response?
I'll be providing some of the response, and I would love for my co-author, Dr. Feng, to join me whenever when I'm not saying something that's fully complete.
Can you turn on the video?
No, actually, I've been talking to Jared. There's some issues with my video, and I think it's
okay, that's fine. Okay, that's fine.
So just to answer the questions, so I think it's because I didn't do my presentation in a very organized manner. So I did not have the opportunity to fully explain how our sample is constructed. And I really appreciate Wei pointing it out that there could be that some of the individuals who are more sick and they are endogenously opting out of the labor force. But actually our sample is based on everyone. So everyone who is at that age group who is covered by the urban employee insurance, they're all in our sample. So we are trying to distinguish a potential coverage effect, and it's not an effect on those who already enjoyed the long-term care benefit. So we think that by that sample construction, the selection is a slightly less of an issue. But I really appreciate the other aspects of the question that concerns about health controls. This is actually a slightly longer story. So we're hoping to use that as kind of a channel of effect analysis, which we do explore in some of the other analysis. But because we try to run a regression on health effects at the same time as the labor market outcomes. And we also do a subgroup analysis by health. So that's why we didn't control for health effects in the baseline. But I really think it should be one of the controls in the final version of the sample of the model. And then the employment to population variable construction. So that is constructed using the employed individuals having a dummy variable of 1, and everybody else, whether you're in the labor force or not, having a dummy variable value of 0. So if you kind of aggregate the individual responses, it doesn't respond to employment rate. And so it more corresponds with employment to population ratio, because the denominator is really the overall population at that age group, rather than the people who are currently in the labor force actively trying to seek a position or actually being employed. So we do have an alternative specification based on employment alone, and the results are just different in magnitude, but are also significant because they're kind of based on different population size. Sorry about not explaining the samples properly earlier and causing a slight understanding. Thank you so much for the question.
Okay, great, thanks. Songjin, you have anything to add?
Yeah, thank you for the two discussants give us very useful comments and questions. And for the endogeneity of LTC, we think because the sample we are using is all covered by urban employee health insurance, so it's not voluntary. It's kind of mandatory in our sample. They are all formal employees, and we also exclude most of the disabled people in our sample because we focus on the like a life cycle theory story. Like if one has covered by the LTC and her or his potential health long-term care long-term care expenditure will decline in the future or possible in the future. So they may have not necessary to save more, and their labor supply is declining, especially for those people with chronic disease who are more likely to be disabled in the future. So that's what the purpose of our paper. And also Winnie's question is about the strategy of DID. If I hear clearly, that even the cities have pilot program of long-term care insurance, they have a lot of differences in the policy rules, right? Is that a question? Yeah, that's a very important question. So for currently, we haven't seen or go deep to the differences of the policy in different sites, but we did some research on the difference of in some cities they provide cash subsidy, in some cities they reimburse the service cost, and we do find similar results for this, because what we are focusing on is on the future benefit that people realize that currently even they are quite healthy right now, but it's like they don't need so much precautionary savings, etc. Also, one question from the list asked if well-educated people have more response to the policy. Also, we divided the sample by using education attainment, but we didn't find any significant difference so far. But this is the quite preliminary paper we are going to study more in the future. Thank you.
Great, sure. We can have more time to come back to this. Sharon, you want to just provide some brief response as well? I would add a question. I find your result interesting in terms of mortality reduction, but I'd like to know a little bit about the mechanism. What is it in the long-term care insurance program that would actually reduce mortality rate? So,
okay, let me answer your question first. Actually, we just saw the impact on the mortality is about like, let me check that. So okay, so for the mortality with, okay, sorry. So we just show the average mortality rate, yearly average mortality rate is about 11%. So in the sample, and we see the impact on the mortality is 0.5 to 0.6 percentage point decrease. So that means the magnitude is quite high. Okay, so that's for the mortality impact. And for with comment, thank you very much for your comments. And I really think due to the time constraint, I was not so clear about our method at the definition stuff. So actually, in our paper, we actually compare people in cities, in pilot cities, and those who are in non-pilot cities. So currently, so far as we know, so far there is no data set in China that have information on individual level eligibility of long-term care insurance. So basically here we are actually estimate average treatment effect by comparing individuals in different different cities. And for the second question, that is similarly. For the criteria, we just introduced that in the policy part. So this criteria is for the policy, but in our study, we actually divide treatment effect not by this criteria, but by the city, whether it is a pilot city. So I just want to clarify this. Sorry about the confusion. And for Zeyu, thank you for not criticizing anything here. As far if I understand you correctly, and we agree with you that the long-term care insurance currently maybe there still needs some like service in equipment stuff, just like what we found in our study. We saw the heterogeneous effect between people who are living in communities that have equipped with public service, with those who do not live in those communities. We do see the impact actually falls mainly on those who actually equipped with those kind of services. So we do agree with you that in the future, we may need all sorts of other services and maybe other improvement in long-term care insurance. Okay, that's basically my response.
Okay, great. Thank you very much. Very brief and precise. So let's turn to the other two papers for the time being, and we can come back fully with time to have all the four papers interact. So can I invite Professor Zhen from the Chinese Academy of Social Science to present his work on looking at a very recent policy proposal to increase retirement age in China and its potential impact on the pensions funds in China. Professor Zhen, please.
Thank you. Many thanks to host Professor Winnie, and many thanks to Professor Qiu Yue, who introduces me to attend this in this conference. It's my honor to have a talk within 12 minutes with you. There are so many old friends on the website. I saw Professor Feng Jin from Fudan University and others as far as in Australia and some other countries. My topic is the impact of raising retirement age on public pension funds sustainability in China. I have prepared some slides and divided into 7 or 8 parts. The first question. The current retirement policies, I have to first of all to introduce some main points. Right now, there are 3 small groups divided into 3 as respect of retirement age. Of course, it is related with 3. The first group is a female worker. Now they are 50 years old at the retirement age. The second group is a female senior managers or cadres, 55 years old as their retirement age. The last group is male workers and the managers, 60 years old. Last year, and at the very beginning of this year, the central government declared that during the coming 5 years, the raising retirement age will be launched. And if it is launched, what's the impact upon the sustainability of the public pension funds? So I just make some projections, and all the data coming from the report of pension actuarial from 2019 to 2050, published 2 years ago. Let's suppose we have some symposiums. The first, let's suppose the reform will start in the year 2022. The second, for female workers, every 3 years, raise 1 year, raise 1 year old. Third symposium, the first symposium, one female workers from 50 up to 55, and male workers and the female senior managers. These two groups will join in. Also, every 3 years, raise up 1 year. Both female workers and female, both female workers and female workers and the male workers, they are simultaneously raised up. The last, eventually, female workers and the managers will be raised up to 60, and the male workers to 65. And this is some conditions. The second part is the comparison. The second part is the comparison of the number of retirees. On the left of the slides is without raising retirement age, and on the right it is with raising retirement age. Let's compare the two, before and after reform. Let's see graph 1. In 2019, the total retirees is 100 million people. And in the year 2000 and in the year 2050, in the year 2050 here, will raise up to 279 million people. It stands as for percentage more than 60. Let's see the slide on the right, under reform. In the year 2050, compared with before reform, the number of retirees will be lower down to more than 200 million. It means 210 million people. And the percentage, it will be lowered down to 57 or 56%. It means before and after reform, the number of retirees will be lowered down very significantly. This is the second part. The third part, the comparison of the dependency ratio. Let's see also on the right, on the left, without raising retirement age before reform. The dependency ratio in the year 2019, for the participant dependency ratio as 47%, 47% here. But in the year 2050, oh, I'm sorry. Let's see the blue curve. Blue curve is a participant dependency ratio. In the year 2019, it's 70.7. But in the year 2050, it's raised up to 81.8. 81.8. After reform, in the year 2050, it will be lowered down to 51.4. It means the dependency ratio will be lowered down very much, very much. This is a participant dependency ratio. In China, there is a very typical phenomenon, very, very typical, because the maximum limit of contribution years is 15 years. Is 15 years. If you contributed for 15 years, okay, you will be eligible for benefit. So more and more people are becoming, will surpass the limit. So more and more people stopped their contributions. They just wait. For their retirement age coming. So we have another parameter. That means contribution dependency ratio. It means contributors is less than participants. 10 years ago, perhaps 90% of the participants are contributors. But right now, 80% of the participants are contributors. So 10 years passed and contributors are becoming less and less. So let's see the red curve. For the red curve in 2019, the contribution dependency ratio is 47%. But in 2050, it will rise to 96, nearly 100%. It means nearly one people support one. But after report, in 2050, the contribution dependency ratio will be lowered down from nearly 100%, lowered down to 65%. So it's quite significantly, quite significant.
Professor Chen, 2 minutes. 2 minutes.
Only 2 minutes. Oh, okay. Yeah. Part 4: the comparison of funds income. In the year 2019, the income is very few. But in the year 2050, it will be 24, nearly 24 trillion yuan. 24 trillion yuan. 24 trillion yuan for the income. But after reform, the income will be raised up to nearly 25 trillion. Okay. And for the expenditure, it's much more significant than the income. Before reform, in 2050, the expenditure is 35 trillion yuan, 35 trillion renminbi. But after reform, it will be only 28 here, 28 trillion renminbi yuan. Okay, let me see the balance. Let me see balance. Before the reform, the balance, the reserve, the balance will be exhausted in 2035 here, 2035. But after reform, it will be extended to 2042. Last slide. The comparison of the total gaps, in the near 30 years, the total gap before reform, it will be 87 trillion renminbi yuan here. But after reform, it will be lowered down, reduced to only 17 trillion yuan here, 17 trillion yuan. So during the past 3 years, the fund investment return rate, I mean urban employee pension assets authorized to NSSF, National Social Security Fund, as 5.6%. I just use it as a discount rate, so I can conclude before reform, if we discount the 87 trillion renminbi yuan at the rate of 50.6% to the base year 2019, we need more than 20 trillion pension funds right now, to cover the future, the whole gap. But unfortunately, right now we haven't such amount of pension fund. But after reform, I can conclude, if we also discount the 17 trillion renminbi yuan at the rate of 5.6% to the base year 2019, we only need 3 trillion pension funds right now. It covers the whole gap in the future. So by the end of the last year, the urban employee pension assets was 6 trillion yuan. That means raising retirement age is okay for its sustainability. So this is that's all for my presentation. Thanks a lot.
Thank you very much. Thank you. Thank you for the projection, as the policy is still very new and it's very informative. So next, let me turn to Gawei to present their work on one country, two system, comparing the urban and rural situation. Thanks. Go ahead.
Thanks for having me. You can hear me, right? Okay. Thanks for hosting the webinar as well. This is a joint work of the Charles team headed by Professor Yaohui Zhao and also Professor Xiaoyan Lei, who was just presenting, and our advisory committee member Zhang Zhao's previously, and from the World Bank. And it's great to be the last one, and I think Professor Xiaolan already introduced our data, the Charles survey data, and also thanks Professor Bingwen Zheng, who has given us a very nice design for future delay of the retirement age system. And we know the big picture. And this paper is going to showing us some statistics about a very important disparity between the two retirement systems in the urban area and the rural area in China. And we think it's important, and we think the stylized facts we are going to show here is also very important. And so Professor Bingwen Zheng is talking about the design and to solve the problem for the fiscal burden. And because we know in the long run, it's not going to be sustainable if the retirement age still remains like we currently have. And here, this paper focuses on the issue of labor supply. So how the older Chinese make their decisions according to their current retirement status. And we're going to use the child's data because it's nationally representative. So this is going to give us some precise estimates, and we think this definitely can help us think carefully and think more precisely about the future policies. So the first, I'm going to describe the data and some return patterns, and then I will just show you how we can confirm our hypothesis that under the two retirement system, different people will choose different retirement decisions, and then later we are gonna just have some empirical analysis. And Charles, so I'm gonna skip this. We know it's nationally representative, and then we're gonna use the fourth wave, the latest 2018 wave for this paper. All right, so let's first define retirement. And here we are talking about the actual retirement, not the administrative retirement, not the employee mandatory retirement, which has been introduced also by Professor Zheng. So here, an individual is retired, it's just he or she was not working at the time of survey. It's just that simple. Here, we also include the unemployed to the retirees because the unemployment rate is very low in China for the older population. It's just below 1%. All right, so here we divide the total older population into 4 groups, and by gender, by female and male, and also by their hukou status. And here, the urban residents, we denote them by those with non-agricultural hukou, and the rural residents as those with agricultural hukou. So here you can see the upper 2 curves displays the retirement rates for urban residents, and the lower 2 curves are for rural residents. So they have quite different retirement rates, especially at the age of 60. You can see the orange line here, and the urban male retirement rates increase sharply at the time of their mandatory retirement. And afterwards, so beyond the 70, only fewer than 10% of urban residents are still working. But if you look at rural residents, their employments just keep rising and rising, but not that dramatically. So even beyond 80 years old, some of them are still working. So then we can see, so someone just says, okay, so our rural residents, our rural workers, they just keep working and until dropping. They are endless workers or endless toilers. Oh, right. And to make some international comparison, we here include 7 OECD countries and 2 Asian developing countries, India and Indonesia. And the first 3 on the left are China and China's rural area and China's urban area. And the entire bar measures the entire retirement rates for the age group. Here you can see even for China's urban males, their retirement rates beyond 60 or even larger than some OECD countries, for example, the USA or Japan or Korea, South Korea. And for China's urban women, their retirement rates actually are the highest at the age group between 55 and 59. So here we also decompose China's retirees into those who care for their grandchildren and those who do not. And you can see half of China's urban women are actually carers for grandchildren. And what's the difference between the 2 retirement system? For the urban employee retirement system, they have a mandatory retirement age. And for the rural retirement system, okay, beyond a certain age, they can have some pension receipt, but they do not have a mandatory retirement age. And this can be confirmed from how we calculate the hazard rates of retirement. Here you can see there are 2 spikes for urban women at the age of 50 and 55. And there are also 2 spikes for urban men at the age of 55 and the 60, because in China, we have some early retirement and going on for urban men. And for rural residents, we don't have actually such kind of spikes around any age. And we can see this difference is quite pronounced here. And how about the outcome from the 2 retirement system? And if for an urban resident, if he enjoys employee pension, then the receipt you can see here, the median monthly receipt is very high. It's about 2,900 per month. But for a rural person who majorly only can have a resident pension, and the median monthly payment is just 100 yuan. The difference is very large, and 80% of urban residents actually can enjoy this employee pension, but only 5 of rural residents with agriculture hukou have some sort of employee pension. And if we divide the groups into urban males, rural males, and the urban females, rural females, and you can see the difference exists across age groups, across different genders, but the difference majorly lies in between the 2 retirement systems, between different people with different hukou. In the last, so we are going to put the retirement decision into a very simple model. And this is a regression with a dependent variable of working. So it's just the opposite of retirement. If a person works and the dependent variable is equal to 1, otherwise it's 0. And we have a lot of explanatory variables. Here we just include some estimates which are statistically significant. Aside from these variables, we also control for personal characteristics. For example, education. We also control for spousal characteristics. We also control for household characteristics. For example, household wealth, housing value, etc. Here, so first variable, age. This measures how urban residents respond to the mandatory retirement age, right? So basically, it's just their retirement rates increase sharply beyond the age of 60. It shows this result. And the second variable is the number of household members under 6. This measures the caring demand, right? If there are someone who is under 6 in the family, so the older population may want to retire and to care for them. And here you can see, so this effect is only significant for rural females. And even for urban females, it's not significant here. And then let's look at the third variable, number of ADL and IDL difficulties. ADL is activity of daily living, and IADL is instrumental activity of daily living. So basically, it's a measurement of the number of disabilities, and it's a measurement of a person's health status. The higher the number, the worse a person's health is. So you can see this variable has all, okay, thank you, has all negative coefficients here. But the interesting thing is the coefficient for rural residents is a little bit larger. So it seems to suggest that for rural residents, health might be a more severe factor here, right? So disability did put a person out of the labor force. So you can see the coefficient is not that large, but considering the total number of ADL, IADL difficulties can be as high as 11. So if you compare a person without any difficulties or a person with full disabilities, then the effect can be still large. The third and the fourth variable measures the impact of pension income, right? So definitely this is consistent with our hypothesis. Receiving employee pension reduces employment probability in a dramatic way. So it's about 90 percentage points for urban men and 20.6 percentage points for urban women. That's very large considering their already low employment rates. But because of the low resident pension income, the variation of this variable is low, so the coefficient for this variable is not that large and not that significant for the four groups. It's interesting to look at the last variable, spousal health. So the spousal health actually, a worse health status actually raises a spouse employment probability for rural residents. This, I think, corresponds to what has been discussed by Professor Xiaolan, and right. So basically, long-term healthcare can actually reduce someone's employment participation rate. So it's very interesting to see here. It might suggest that long-term healthcare can, if they can take care of spouses, and so this reduces the financial burden, and this can reduce the financial costs according to healthcare. All right, so this is all the results I'm going to present today. And so here, the bottom line is retirement patterns are very different in urban and rural China. Rural elderly work until dropping. So when we consider to raise retirement ages to reform the urban employee retirement system, please don't forget the huge disparities that still exist and that might still exist in the long term between the rural area and the urban area. And the retirement patterns can be explained by mandatory retirement policy and can also be explained by the urban-rural gap in their economic resources. Here, we want to say it's the pension income. The difference is huge. And definitely, so here, this paper is mainly about standardized facts, how to design the policy. We're going to leave that to other experts like Professor Zheng. So he has already given us very nice forecast. So to have a good reform, so we're going to have a sustainable future. Okay, thank you.
Okay, thank you very much. Let me invite Professor Fang Haiming to provide some comments.
Thank you, Winnie. Let me turn on the video.
Yes.
Okay, I will share my screen. Okay, so I hope you can see me in my slides. So yes. Thank you very much, Winnie, for inviting me to comment on the two very interesting papers. And actually, it's great to see, the Professor Zheng and Ge Wei to. I didn't see Professor Yao Hui Zhao and others in this panel. It's great to get together virtually. So I will first comment on Professor Zheng's paper, Impact of Raising Retirement Age on the Public Pension Fund Sustainability. As usual, Professor Zheng provided detailed authoritative analysis of the budgetary implications of delaying the retirement age to 60 for women, gradually, like 1 year for every 3 years, 1 year increasing pensionable age in every 3 years, and to 65 for men. And the message of the analysis is very powerful. It's basically, it shows that the delaying of the retirement ages, right, as proposed in the reform, will ensure that the funding gap in the urban employee pension system with a 5% discount rate is essentially closed, right? That's the bottom line conclusion in Professor Zheng's projection. So that's great, but as my comment will basically be suggesting some alternative kind of considerations, right? In any projection, the assumptions are the key. Professor Zheng mentioned some of them, but I think it will be important to spell out these assumptions, justify them as much as one can, and possibly show a range of estimates with alternative assumptions of some of the key parameters that one may not have 100% confidence. For example, right? So we know, actually this was also shown in the first two papers presented related to long-term care, and also Gerway's paper, the labor supply, right? The health conditions, ADLs, AIDLs, as well as self-reported health can all limit one's ability to work. So that how is that labor supply response to the proposed delaying of the retirement age being accounted for in the projection? That will be something useful to know. Maybe it's in the paper. On the labor demand side, Gerway mentioned that as well. And in a paper with Professor Zhang Yi at Shufei, we also emphasize this, is that when while the policymaker can propose to delay the retirement age and assume, is it reasonable to assume that the elderly now who would have to work a little longer, will they find employment at the wage that they want to, they are willing to work for, right? So this is not an easy assumption, because as actually Gerway's paper showed, there were quite a lot of earlier retirement. Even despite the early retirement age now in China, you still see a lot of people between 45 to the current retirement age left the workforce, right? So what's driving that, right? Which firms will employ the older workers at what wage? This again is not obvious. It requires some a discussion about what assumptions being made. Spillover effects on the young, right? So this was, I think, a powerful message coming from, I think, actually in Gerway's presentation. We see the Chinese young elderly actually do a lot of caring for the grandchildren, and that intergenerational kind of childcare service provided by the young elderly were found to be significantly related to the labor supply of the young couples. Okay, so the spillover effects on the young's labor supply is an important consideration. And of course, the productivity growth, right? In any pay-as-you-go social security system, productivity growth and dependence ratio both impact the fiscal condition of the system. What is the assumption being made on Professor Zheng's projection? Finally, to talk about the fiscal implications, one would also have to account for the changing enforcement of contributions. Professor Zheng mentioned that a lot of pension system participants stopped paying the social security contributions after they have paid 15 years of contribution. Now, of course, we know a couple of years ago there has been a change in the authority that collects these social security contributions, moving to tax authorities. That could increase the contribution enforcement. So these things I thought would be great to spell out. And finally, I think the one thing that I want to emphasize, I think this is echoing Gerway's point, is that China is a very heterogeneous country, and the population is heterogeneous, the regions are heterogeneous, and one size fits all policy often will have important redistributional impact, right? So high and low education, for example, differ quite a lot in life expectancy, up to 3.5 to 4 years difference in life expectancy depending on gender. Higher educated people, of course, live longer. When the retirement age, pensionable age is raised uniformly to the same level, that could have very important implications regarding redistribution. So to make some suggestions for a very nice paper already, I thought it would be ideal, right, to provide a little bit more outcome measurements of the impact of the policy, not just the overall funding gap as being emphasized currently. Secondly, I thought Professor Zheng and his team can really provide a great service to the policymakers by allowing policymakers to input different parameters in the projection and allow for some uncertainty as well, right? So basically, I'm imagining like a web system where policymakers can play with different productivity growth rate assumptions, labor demand assumptions, and so on, so that they can get a more nuanced picture of the impact of these the proposed increase in retirement age on a range of outcomes, including the funding gap, but also something more. Okay, the second paper, One Country, Two System paper, it's again very interesting, provides a detailed comparison of the rural and urban pension system, contribute to the literature that documents the large disparities between rural and urban systems. And I think it's very important to understand these differences in order to think about the potential implications of the proposed delaying of the retirement age. Okay, now, so I think the paper contributed to, for example, documenting, one important fact, which is the earlier, a lot of earlier retirement, people retiring earlier than the already quite young pensionable age as of now. So I think it's very important to ask why. Why are people retiring at 45 to 60, right? While they are still not yet eligible for pension. And the hypothesis is that I think they are both push and pull forces. Some firms are pushing the older workers to retire early, and older workers themselves may want to retire early to help raising their grandchildren, right? And this is, of course, related to very rapid inter-cohort productivity growth in China in the last 3 decades. Skills in China become obsolete much faster than in the United States. In my research with Zhou Xingchen, we documented that these kind of facts. Okay, and the second thing is this has important implications for the delay of the retirement age. Who will hire the older workers and what pay? Right, that's related to Professor Zheng's comment to Professor Zheng's paper as well. So I have a feeling that we need to provide much more retraining if we want to raise the retirement age, because otherwise the economy may run the risk of moving to informal sector, right? The elderly who are now forced to work a few years longer would find difficulty finding the formal jobs. They move to informal sectors, right? And this paper also provides a clear evidence of young old, those between 50 to 65, caring for grandchildren. And this intergenerational spillover is important, particularly because the government is also want to encourage childbirth, raising the fertility rate, right? When the older workers are now, have to work, so they will no longer be able to play the role of caring for the grandchildren. And a lot of young couples have stated the cost of raising children being one of the primary reasons for them to be hesitating in having more childbirth. So I would say within the context of the paper, I would also encourage the team to look at more differences between rural and urban population, not just labor supply, mental health, physical health, etc. Okay. So finally, let me just conclude the broad comments. On average, retirement age in China is too young. It's not, if 50 or 55 for female, 62 male, these ages were set long time ago, before the large increase in life expectancy in China, right? So there's no good reason to feel like these current retirement age are anywhere scientifically determined, right? So I think probably China should be thinking about indexing the pensionable age to a national average life expectancy, okay? And as for example, Sweden does. So, and I think it's also important to recognize that there's a lot of heterogeneity among subpopulations. So flexibility will be important. A more flexible combination of retirement age and pension benefits, and let people choose a menu from the menu of retirement options may be something to consider, okay? Also, we need to think about the labor demand side to incentivize firms to train, retrain, and hire older workers. Finally, we should never forget that in any pay-go system, the productive growth can really be the ice on the cake, the icing on the cake to make a lot of pain go away. And China, of course, has grown spectacularly in the last 30 years. And I think it's important to never forget that anything the government can do to keep the productive growth lasting longer, including, for example, improving rural education, as argued in Scott Rozell's recent book, The Invisible China. I think it's important. So thank you. I will stop here, and I really enjoyed listening to the two presentations.
Great, thank you very much, Professor Fang, especially drawing on the interconnectedness of the several papers, not just restricting to the one you you asked to comment on, and also drawing on your own very rich research related to this area as well. Thanks. And can I invite Dr. Derwin Wang from the World Bank to provide his comments on the general topic of pension retirement as well?
Okay. Let me share my screen. Hope you can see my slides.
Yes.
Great. So first of all, I just want to thank you, Winnie, for inviting me to join this very fascinating webinar. Actually, I learned a lot from 4 articles. Although actually, my job, actually, from World Bank side, I have been working on China pensions, and also long-term care. So basically, this is the area I have a lot of interest. But as you advised, I will mainly focus on the 2 papers on the pension and retirement patterns. So first of all, I fully agree with Professor Fang. Actually, it's a very interesting paper on China pension related issues. But the focus is quite different, although they are highly relevant. Professor Zhang's paper not only focus on the urban works pension scheme, and also focus on they just present the simulated results and also impact on the retirement age on the urban and the pension funds for the urban works pension scheme. So his presentation focused on urban works pension scheme and how actually the raising the increase the raising retirement age and what are the simulated results and the scenarios. So what kind of scenarios would be. And also the second paper actually from Professor Gero Wang, he actually is also quite interesting, present some stylized kind of facts, like the pattern of the retirement pattern between rural and urban, and also what are the 9 factors as it cause this kind of the difference between rural and also urban area. Basically, as Professor Fang already highlight, actually both papers actually they touch upon some important questions related to the pension system and policy, and also more broad the questions in terms of how China cope with the challenge of population aging, and how actually implement this so-called active aging policy and also hazard aging policy in China. So actually, three kind of related questions I will just want to highlight. Basically, the 2 papers raise one type of question related to the pension system assessment. So what kind of pension system would be ideally for China to go? So that is normally from the World Bank side, we focus on 3 areas coverage, adequacy, or fairness, the financial sustainability. So this is related to the pension system assessment. But the fundamental question regarding the pension policy, that is also particularly the Gary's paper, if we say using pension as one institution, then we should ask ourselves, what are the key objectives when we talk about the pension system design? Basically, the 2 from welfare economics or pension economics, there are 2 major two major functions or goals for pension design. One is the old age income support to address the elderly poverty, another is the consumption smoothing, something like that. So because why I highlight this goals, that is related to these 2 major schemes I was talking about later, particularly for the Gary's paper. When we compare rural and urban, the difference, the disparity between the urban and also the retirement pattern and also the benefit level, something like that. And also, if we're looking forward, basically, the more broadly for China pension reforms, there are 2 kind of issues. One is incentive, how actually to provide incentives for people. Actually, they can choose what do they want on one hand, and on the other hand, actually, given the pension policies as Professor Zhang's presentation, although we can simulate, but the reality how people respond, particularly from behavior side. So from individuals, from workers, from employers, as also Professor Fang's already mentioned. So to what extent actually the firms or the employers that we need to hire the older workers, so they're quite challenging. Not just the older workers, particularly the female older workers. So this is one of the issue. Another issue, actually, given that different stakeholders, they model hybrid issue, because as China, actually, a large country, even if we can do similarly, we can simply just make some recommendation, but there are large variation across space. Actually, even, for example, different regions, they respond in terms of the pension reforms. They have different incentives. They have different ways to play games with the central government. So we should keep all those things together when we talking about the pension system. When we look at even if look at some of the basic facts, how to interpret this basic fact is quite important. That is actually what I learned from these two papers. But I also want to highlight why actually we need to think about when we assess the pension system, the reforms update where it stands, and also think about where China pension system should go, and how this reform will be linked to other dimensions of the reforms, and what are the key fundamental questions we should keep in mind. So just go directly to the specific papers. Basically, from World Bank side, we have done a lot of work, actually, not just in China, but also in other countries. We advertise. So increasing retirement age is one of the important policy instruments to addressing the financial sustainability, the challenge of financial sustainability. As Professor Zhang already shows us, basically, increase in the retirement age can have actually quite significant implications to the pension fund, the balance of the pension fund, and also largely, but also partially address the challenge of the financial sustainability issues. But the question is what the Professor Zhang's from his simulation, he just make assumption. From my understanding, actually, is incremental approach. Basically, increase the retirement age for women first, and then goes for women and men together from 50 to 55 and 55 to 60, and then from 60 to 65, something like that. So more or less similar to other countries in OECD. So, but even in OECD countries, some countries they do more radical reform, some actually do also the incremental reform. Question is in China, basically, this kind of issue has been discussed for many years. Although the central government already launched, they were implemented in during the 14 5 years. We don't know when. So it might be good from Professor Zhang to tell us when, from his guess, this policy will be really implemented and how. Because actually from our side, I understand in the year 2013, actually World Bank and also the 6 other institutions were involved to do.
You might want to be a bit more brief, and so you can.
Okay, good.
We're running out of time a little bit. Sorry about that.
Okay, so I will keep short and precise. So basically, I will not talking about the story anymore, but just so there is one point I want to make. So when this policy will be implemented and how, because from Professor Zhang's presentation is still a kind of assumption. So this is one. And also, actually, as I already mentioned in my previous slides, basically, if we do just a simple math, basically the simulation is quite direct and intuitive, because if we increase the pension age, the retirement age, basically there are more contributors and also have more revenue, but also actually less pensioners and less expenditures. As I already mentioned, basically we are holding the other things unchanged. As Professor, I fully agree with Professor Fang's argument. Basically, it's better to introduce more kind of these scenarios and the different parameters, because there are different parameters related to behaviors and the labor market response. For example, even if we are talking about the urban works pension scheme, but also actually has implications to the labor market participation. And we cannot simply just assume increase the pension, this retirement age, all the workers will be like employed completely. So what are the like labor market participant rate, and how actually response from the firm's level? So there will be something actually from Professor Zhang's side will be like be great. And also maybe another related issue also like is longevity kind of a risk. I don't know whether Professor Zhang already considered, like for example, the longevity kind of a risk, because given this the health like expectancy will be further increased in China. So to what extent we actually for us to do this actuarial projection, we already consider this kind of like factors in our like actuarial projection. Another last point for this paper is that basically from Professor Zhang's like presentation, he already talking about the pension fund gap for the urban workers pension scheme. But from our studies, we don't know actually what exactly the size it is. Although the central government already like a state, they want to put this like actuarial projection in place, but we never see if this this kind of exercise already in place or not. So basically, to address the pension kind of the challenge of financial sustainability needs like both parametrical reforms. There are many like factors related to parametrical reforms. Increasing the pension age is one of them. So there are others, for example, the indexation for the pension benefit and also others. But also more fundamentally, China needs a kind of a financing strategy to fill in the pension gaps. Right now, actually, Professor Zhang's paper already focus on the urban works pension scheme.
I need to ask you to wrap up because we are at time.
Okay, yeah. So this is like for the Professor Zhang's paper, but also more like let me. So Winnie, maybe if time's already like run out of my time, I don't know whether you want me to comment on the Gowei's paper, or just I can leave it for maybe for discussion.
Why don't you maybe just quickly talk about one most important point you want to get across, and then you can share that with Gowei afterwards.
Okay, so just one most important point, burning point from my side. I do think probably should be careful, not just talking about rural and urban, like this kind of comparison. From my understanding, basically you should look at the nature of the pension design in China, because there's a lot of people actually using China. Actually, we have the hukou, it's quite unique in China. So people automatically compare rural and urban from the hukou perspective, from the institutional barriers. But if you look at the pension design, actually in China, there's two kind of design. There are specifically one design actually for the formal sector, another design from the informal sector. So if we are expert from pension perspective, basically it's something actually related to the informal sector, right? So that is my point. So if we look at this paper, probably there is also one of the issues related to the regression, because if you look at the regression part, it's also quite interesting actually the putting from urban, they have mixed kind of rural and urban benefit, something like that. For the rural one, still the same. But if you look at the system, it is a targets and eligibility or something like that. It totally in nature is quite different. That's why needs to rethink how actually to frame the storyline, and also based on the stylized effect and draw policy implications. I just stop here.
Okay, great. Thank you very much. Unfortunately, we have passed the time allotted to this pre-congress session. And I noticed that Professor Zhao Hui, a key author of the last paper, also has joined us. And I would just, for the attendees, if you are willing to stay, we will spend another 3 minutes or so before we close. I just want to give the opportunity of Gowei and also Professor Zhang to give one quick response to the key comments. And I think today's session has raised a number of very complex issues that each of the paper has addressed part of it. And but it just shows that the field really is looking for a lot more work to fill the gaps, to inform policy, And I would also say that as president of IHEA, one of my goals for this round of the Congress is trying to present work that also has major policy implication to see the linkage between the economics and the policy. And I think this was being brought up by all the 4 papers, but it's also showing that a lot more work still needs to be done. And so very promising for junior people in particular, very fertile ground to invest in it. So I don't, I want to know if Professor Zheng and Dr. Wang, either of you want to just have one quick response to the comments that is provided before we close. So, Professor Zheng, are you around? And go away, Dr. Wang.
Yes.
Great.
Yeah, I will quickly respond to the 2 discussions, the 2 old friends, Professor Fang Hanming and the senior economist from the World Bank for Wang Dewen. Their comments are very, very good. I just want to explain some points for you too. First point, the mandatory retirement age is very low, but in fact, retirement is much lower than that. Combined both sex gender of female and male, and the mandatory retirement is 55. But as a matter of fact, they are only 54, 1 year old less than mandatory. This is the first point. The second point, Professor Fang, you say different assumptions, different parameters, different hypotheses, there must be different outcomes. Yes. For the actuary report, we just divide these parameters and assumptions into 3 parts. One is population. Second is economics. Third one is pension systems. Each of the 3, there are dozens of parameters and assumptions. For instance, the discount rate pick up 5.6%. The investment return rate, but for OECD, it assume 2% as their discount rate. If I use 2%, before reform, we need more than 50 trillion Chinese yuan, renminbi yuan. So quite different, this is the second point. Third point, the taxation authority has already taken over for the contribution collection. So 3 years ago, the contribution collection system is reformed. But in China, it's quite useful. It is not useful to make contribution enforcement. I agree with Professor Fang and Professor Wang. In China, more incentive is more important. It's much more important than the reform of taxation, the reform of contribution collection reform. The 2018 reform is the case. Yeah. The last point is that I agree with the 2 discussants. discussants. There are so moral hazards. The system as such is much more disintensive. So in the future, the reform will be focuses on the incentive reform. That's much more useful reform. So this is my response.
Great, thank you. Yes, lots of behavioral changes that we can anticipate and need to be studied more. Yes, Wei, you want to just provide some quick response to pick any major comments that you want to respond to?
Sure. Thank Professor Hanmi for your comment. So your comment on the 5 factors to understand better the older labor market is very important. So I think productivity and the labor demand, these 2 issues definitely is the key part to help the older Chinese to benefit from economic growth, to help them to have a better late life. Of course, that's very important. So that can be our future research. And I also thank Professor Dewen for your comment. So your enlightening points just let me think more about the general equilibrium effects to design the retirement age system. So when the age is raised, we should think about how those workers responded to that new retirement system, how they might contribute differently, how they might want to switch from the formal sector, the informal sector, and those 2 sector segmentation is very important to understand, I think, the older labor market. Thank you both.
Great, thank you. I want to thank all the presenters and all the discussants for a very rich session. I just want to say that even though this session is called Aging in China, but the issues that are being presented and brought out today is not just China specific. It is general challenges that many economies that face a aging population or soon to be aging population will have to confront. And I hope that this is providing some fruitful thoughts for everyone that is working on China or non-China, but interested in the issue of aging. So until tomorrow, we have another pre-congress session on thinking about how do you finance and provide for the lowest income people. And then next Monday, we will officially start the IHEA Congress. So thank you all for presenting, commenting, and attending. And I'm grateful. Thank you. Bye-bye.